The U.S. Surgeon General has declared the decline in youth mental health a national emergency. Now, Knox County Schools is trying to curb the crisis with a partnership helping thousands of students. And one mom tells me it saved her daughter's life.
It went from having a stomach
The U.S. Surgeon General has declared the decline in youth mental health a national emergency. Now, Knox County Schools is trying to curb the crisis with a partnership helping thousands of students. And one mom
Uh-oh, he's coming in. We're good? Okay. I'd like to call our Valentine's Day House Health Committee to order. Will the clerk please take the roll?
Representatives Bain, Representatives Boyd, Capley, Carringer, Clemens, Faison, Farmer, Gillespie, Hakeem, Hawk, Haynes, Himmer, Hicks of Hawkins, Hicks of Washington, Hill, Jernigan, Kumar, Martin, Mitchell, Rudder, Sherrill, Travis, Vaughn, Whitson, Williams, Vice Chairman Leatherwood, Chairman Terry.
There.
Chairman, you have a quorum.
All right, thank you. And before we get started, do any of our members have any personal orders? All right, seeing none, we do have actually two calendars today. We have a regular calendar and an addendum, and then we have a budget and presentation from mental health and substance abuse. So I'm going to go out of order and take up the addendum calendar first. Item number one, House Bill 469 has been taken off notice. Item number two, House Bill 827 has been taken off notice. That brings us back to our regular calendar. Representative Slater, you are recognized on House Joint Resolution 778. You are recognized.
Thank you, Mr. Chairman. Thank you, committee
you have
members.
Motion and a second.
This is a substantive joint resolution that, if passed, will make February 24th SCN2A Awareness Day in Tennessee. And since this is an Awareness Day type of bill, I think it's appropriate that we're in the Health Committee and we can raise awareness right among this committee that sets policy as it relates to health. If you'll indulge me just for a couple of minutes, I'll start with where this bill came from. I have a colleague where in my other job, and they have he and his wife have a 3-year-old son. His name is Samuel. Samuel is nonverbal, and the diagnosis is, or the prognosis is that he will spend his entire life nonverbal. Fortunately for this family, Samuel was early diagnosed with this genetic disorder. And because of the diagnosis, though treatment may not come about in his lifetime, at least the parents know what they are facing for his entire life. And so I think that it's important because the medical community, this is relatively new to the medical community, due to the genome projects that have taken place. So let me just share with you what SCN2A is briefly. SCN2A is the gene that has been identified to cause autism, epilepsy, and other neurological issues when there is a deletion or a mutation of this particular gene. SCN2A related disorders affect patients in a wide spectrum, ranging from severe life-threatening conditions to intellectual disability, depending on where on the gene it is changed or mutated. Almost all patients will live a life completely dependent on others for their care and safety. This has captured the interest of the scientific community and pharmaceutical companies to discover new treatments, not only to save the lives of the patient, but also to help alleviate the burden. SCN2A is a critical gene for the brain throughout life, not just in early development. This opens the door to the idea that treatments may be effective even if administered later in life. SCN2A is a powerful research model that can lead to discoveries that treat all children with autism spectrum disorder. Although SCN2A related disorders can be easily identified by DNA testing, SCNA related disorders frequently go undetected due to the lack of awareness about the syndrome, even within the medical community. And I'd add to that that Tennessee is leading the way through St. Jude's and also through Vanderbilt University medical research in investigating treatments that may someday be available for this genetic disorder. And with that, Mr. Chairman, I stand ready for questions.
All right, thank you. Do we have any questions for the sponsor of the resolution? All right, yeah, see none. All right, thank you. We got questions have been called. Thank you for your explanation. Without objection, we'll be voting on House Joint Resolution 778. All those in favor say aye. Opposed? Ayes have it. You go on to calendar and rules.
Thank you, Chairman. Thank you, committee.
Thank you. All right, that brings us to item number 2, House Bill 1863 by Chairman Faison. You are recognized.
Thank
got
you, Mr.
You have a
Chair.
Motion
committee.
second. There is an amendment. Is that correct?
Yes, sir, there is.
Drafting code 013319. Is that correct?
That's what I have.
Okay, you have a motion and a second on that. If there's no objection, let's go ahead and get that on the bill so we can talk about it. All in favor of amendment 013319, say aye. Aye. Opposed? Ayes have it. We're back on the bill as amended. You are recognized, sir.
Thank you, Mr. Chair. Committee, this is a bill for dietitians. It's a compact bill that would allow them, if they meet the same standards as every other state that's in the compact, that they would be able to practice in and out through other states. The current states that have this going are Nebraska, Mississippi, Missouri, and Ohio. Also, Georgia, South Carolina, Wisconsin, and Kansas, and Iowa have recently filed bills to do this, and it would start a compact working for those states that you just heard, and hopefully it would grow for our dietitians.
All right, thank you. Do we have any questions for the sponsor of the bill? Chairman Williams, you're recognized.
Thank you, Chairman Faison. I just wondered if this amendatory language includes any powers for the chairman of the Health Committee to limit the number of Fun Dip packets that a member of this committee might eat at one time. I sense the good friend from Davidson County may have a problem with substance abuse, and the number of Fun Dip packets he has at his desk. Anyways, just wondered if that included.
Sure, Chairman Faison.
Thank you, Mr. Chair, and to our very capable chair in finance. Let's talk about the Fun Dip just for a minute. Those of y'all don't know that my wife is a registered dietitian. She has a master's degree in nutrition, And you would think that she would say that we shouldn't eat this. But for our gentleman from Davidson County, I want you to know that she would encourage. My wife would say that all food is good, just not a whole bunch of food. You do have a whole box. I would be careful with that. But for the rest of y'all, maybe a little half a bag and just to enjoy a little sweet today. Some of it'd be really good for you.
Thank
Move previous question.
you. Okay, Chairman Hawk, you recognize.
Thank you, Mr. Chairman. I wasn't going to say anything, but since you brought your wife up, have you made the phone call to her today to tell her what you had for lunch yet? Thank you, Mr. Chair.
Chairman Faison, you recognize.
Thank you, Mr. Chair. My wife is on her way up here and she will ask, and there's sometimes that it's all right to not tell the whole truth as well.
All right, any further questions? Okay, our question's been called. Seeing none, we are voting on House Bill 1863. All those in favor say aye. Aye. Opposed? Ayes have it. Bill goes on to government operations with the amendment. All right, that concludes our calendar of bills for the day. Now we will go out of session. We have Department of Mental Health and Substance Abuse and Commissioner Williams. So if we will go out of session. Thank you for being here, and yeah, thank you guys. Know the drill. Just for the record, talk, tell us who you are and who you're with, and we'll look forward to hearing your presentation.
Thank you so much. Good afternoon and happy Valentine's Day to everybody. I know that this is probably what you're looking forward to on Valentine's Day at the end of the day. Chairman Terry, Vice Chair Leatherwood, and members of this very esteemed committee, we are very honored and feel very blessed to present to you the governor's budget for this upcoming year for the Department of Mental Health and Substance Abuse Services. At the table with me to the left is Ty Thornton. He's our Chief of Staff and Chief of Hospital Operations. Next to him is Heather Gunderson, our Deputy Commissioner of Admin Services. Next to me is Jean Wood, who is our Budget Director. And then on the right is Matt Yancey, who is our Deputy Commissioner of all things community behavioral health related. In the audience, we have Assistant Commissioners of Children Services as well as Substance Abuse Services, and the other team members from our department that work every day to do their very best to work with our partners to get dollars out to individuals that are in need. You'll also see in the audience and also watching online members from our amazing community provider network. Many of you know these individuals. You talk with them. They call me and let me know when you've talked with them. In addition to those, we've got consumer and family organizations, as well as faith-based organizations in the community that are also located across this great state. We're grateful for their support, their dedication, and their life-changing and life-saving services. One story that I'd like to share comes from a client served by Alliance Healthcare Services. Chairman Leatherwood, Representative Gillespie. They serve folks in your districts in West Tennessee, Shelby County, and Arlington. Here she is in her own words. I started getting treatment at Alliance a few years ago when my life hit rock bottom. I was living in utter chaos. After a knee injury, I found myself completely addicted to opioids for 5 years. Once the doctor stopped prescribing them, I suddenly was very sick and I did not understand why. I found someone who would sell me these drugs on the street, and I was no longer feeling sick. Yet those years were the worst years of my life, and I never in a million years thought I would become a drug addict. The opioids got into my brain and convinced me I couldn't function properly without them. Occasionally, my dealer would run out, and I would suffer full-on horrific withdrawals for days. During the time I was using, I overdosed, I wrecked cars, I lost jobs. I told myself that I was a better mother on the opiates. Thankfully, my husband never touched a pill, and he actually continued to support me after all that I put him through, saying he knew I was more than my addiction. A friend that was in the AA program introduced me to Alliance, and I today will soon celebrate 3 years sober. I no longer miss memorable events. I do not feel sick. I can proudly say I'm a mother, a wonderful mother, and my marriage is stronger than ever. Hopefully, my addiction will be just a short blip on an otherwise long and happy life. Thanks to Alliance Healthcare, and as you all know, Alliance is one in many providers that we fund across the state. She says, I will be able to continue in recovery. If you feel hopeless, if you feel like you cannot survive without drugs or even alcohol, there is help. You can do it, I promise. If you go to the second slide in our presentation, you'll see that we fully believe that recovery is possible, recovery is attainable, and recovery is real. So many stories that you hear and that we hear actually demonstrate that through the dollars that you guys give us and that the governor puts forward. If you'll go to the next slide, you'll see our mission and our vision. And you'll see that our whole goal in this department is to create collaborative pathways so that we can help any Tennessean that's struggling in partnership with TennCare and private insurers to make sure they get what they need to address their mental health concerns and their substance use concern. When I was doing this presentation with Governor Lee back near Christmas, we talked about the classic Charles Dickens novel, A Tale of Two Cities. You all know the opening lines. It was the best of times. It was the worst of times. It was the season of light. It was the season of darkness. It was the spring of hope. And it was the winter of despair. That best of times and worst of times sentiment is where we believe we are today in the behavioral health field, because never has there been more attention, more emphasis, more funding, and more amazing resources given. Again, thanks to the wise choices you have made and the governor has given to us in his leadership. We know that these allow us and our providers to respond to the needs of those who are desperate, but never before has the need for these services been more great. Turning to the next slide, you'll see the data that we use in our decision making, the data that we come each year and go over with you all. And you'll see that the latest prevalence data estimates show that about 7% of Tennesseans are living with serious mental illness. 7% with serious mental illness. 20 to 25% with any mental illness. And when you look at serious mental illness, you'll note in that slide that about 386,000 individuals are part of our network, and 45,000 of those are uninsured. We're grateful to our providers who have served in that uninsured piece, 32,000 individuals, and they did so through the behavioral health safety net that you funded. The next piece, you'll see that more than 20% of Tennesseans have substance use disorder. That's more than 1.1 million. 132,000 uninsured. Our amazing community substance use providers continue to serve those with direct treatment services to the tune of about 22,000. Turning to slide 5, you'll note that the Tennessee children and youth numbers have grown. As you all know, that serious emotional disturbance is also considered serious mental health issues, just called differently in kids. We have an estimate of 96,000 total, and more than 5,000 of those are uninsured. You see our community mental health providers served more than 1,300 children last year through the behavioral health safety net and that uninsured number. And on the right, you'll see the growing need related to substance use issues with our kids, with more than 61,000 estimated to have a substance use disorder. On slide 6, you'll note the recognized increases in anxiety and depression, and that those increases have not yet gone away. Pre-pandemic, the generally accepted rate of any mental illness was about 20%. As recently as last September, you'll see the self-reported symptoms of anxiety and depression were about 35% of Tennesseans. Of that overall need, our providers served, in addition to the two programs I just mentioned, around 740,000 Tennesseans, both in prevention work, education work, treatment, recovery, and wraparound services. We also served, as you know, through our hospital network across the state, right at 8,000 Tennesseans that were in need of inpatient hospitalization and in need to get those resources through those hospitals, and then the East Tennessee 3 contracted hospitals that we have. Turning to slide 7, you'll note the top concerns of parents. This literally just came out in a Vanderbilt study. You guys have invested a lot of money in services for these kids across the state, and there's, of course, still a lot to do. You'll note that this recent study said that parents in our state found that bullying and mental health were among their top concerns for their kids in school. And you'll note that social emotional well-being was second among education concerns for parents. On slide 8, you'll see that we're seeing an increase in youth across this state and the nation that are thinking of and processing committing suicide. I was speaking to one of our school-based behavioral health liaisons and was told that a number of youth came into their office, and that first number, 8, one after the other, told her that they were thinking of committing suicide. If you'll go to slide 9, here's where we're excited, though. If you look at that slide, it's clear that our investments have made a difference. This recent study that just was released found that Tennessee ranks top, number 1, the best overall for access to and cost of mental health care and lower rates of prevalence. Really important because we're one piece of that puzzle. When you look at those numbers, it's not just us, it's the private market and it's TennCare in that market. We also rank 7th overall in a study related to adults, 8th for access to care among adults, and then 7th related to the prevalence of substance use among adults. When you're asked what impact your investments are making, I am sure that you can see that these numbers reflect positive results and are something really to celebrate. Turning to slide 10, our school-based behavioral health liaisons, again, something we want to celebrate are the historic investments that you've made. In just the last few years, this slide shows that we've increased the number of students receiving services by more than 200%. Of course, parent permission is involved, and buy-in is very important. The school-based mental health services result in outcomes that matter. Those outcomes include increased academic success, reduced truancy, reduced discipline rates, and increased graduation rates. But I think what's really important is I'd like you to hear from a mom and a parent that were interviewed in this news story in Knoxville, in Knox County. And you'll see that our provider, Helen Ross McNabb, exemplifies one such program, and this speaks for itself. Matthew, if you can play the video, please.
The U.S. Surgeon General has declared the decline in youth mental health a national emergency. Now, Knox County Schools is trying to curb the crisis with a partnership helping thousands of students. And one mom tells me it saved her daughter's life.
It went from having a stomach ache when it was time to go to school to full-out panic attacks when we had to leave the house.
Sarah Owens didn't know how to help her 12-year-old daughter, Abby, after the pandemic hit.
She would sob all day at school, which in turn led to bullying because she's the kid in class that cries all the time. She refused to eat in public. She refused to use the restroom in public.
Sarah was pulling her out of class several times a week and spending hundreds of dollars on therapy that wasn't working. Abby missed more than a month of school, failing nearly every class as her symptoms spiraled out of control.
After so many doctor's visits, I'm like, there's physically nothing wrong with her.
In the middle of it all, Abby's family moved to Knoxville, where she started a new school. That's when an observant guidance counselor picked up on her behavior. Abby was put on a referral list to meet with a mental health liaison through a partnership between Knox County Schools and the Helen Ross McNabb Center. Master's level mental health counselors give students extra support, covering all middle and high schools and offering services at 15 elementary schools. The program has served nearly 2,600 students since it launched in 2018.
This is just really a way to access treatment more efficiently and for us to be able to respond and assist the school system.
I saw an immediate change in her after 3 counseling sessions with the counselor. It was like a light bulb went off.
Abby was able to meet with her liaison after hours and continued sessions via telehealth through summer break. Now she's a straight A student.
It's such a relief to know that your child has a safe space where they can go and talk about these things, and you can address them. You can fix them at that point. So it's just a completely different kid, and we just wouldn't be here today without them.
You can see why we feel so strongly and passionately about this program and why we're so grateful to you, because not only have you given what we've asked for, you expanded it. And it's just one example of many parents and kids and how their life can be turned around, put on the right path, and they can really succeed and excel in school, which helps them in life. Now we'll go to our cost increases. If you look at our first cost increase, you'll note that we are asking to expand once more the school-based behavioral health liaison program. We're asking to expand that and asking for $6 million. Our goal, as we've said before, is to have one in every school. Just like we have an SRO in every school, we'd love to see a school-based behavioral health liaison in every school. They could absolutely help with that behavioral health climate. If you'll look at the next one, you'll see K through 12 Mental Health Trust Fund. These are the dollars that have been allocated off of the Mental Health Trust Fund. That $250 million, $6 million's been given to us, $4 million non-recurring to work across our regional planning districts with schools, principals, superintendents, and also our providers to fund more services. And if you turn and look at the next one, you'll see our substance use disorder treatment request. We're asking for $2 million non-recurring in that area. You guys gave us funding to increase residential last year. This would help us link up operating dollars for that. The Community Mental Health Center Workforce Development, we're asking for $1 million there. I can tell you that TAMHO and TADIS are very grateful, as well as NAMI and TMHCA. This will allow them to have individuals get paid that oversee the licensure process for new individuals coming into the work field. You'll see that our Children and Youth Crisis Stabilization Units, we're asking for $5 million. You guys allowed us last year to put out an announcement of funding to create 2 new kids CSUs. We have one that's successful in East Tennessee. This will allow us to establish one here in Middle Tennessee and West Tennessee. This $5 million will provide that seed operational funding for that in next year. Provider rate increases. We can't say enough about the money you've already given and that the governor's given. We're asking again for an increase there. As you all know, we have past inflation impacts as well as other impacts trying to get our workforce where it needs to be. The dollars that you've already invested have resulted in lower vacancy rates. We're tracking that, as well as lower turnover rates. Then you'll note the Addiction Recovery Program, $2.1,600,000 for that. Those dollars will actually help once a person's gone through detox, they've gone through residential, and they're in the community. These are wraparound services to providers to make sure that that individual gets what they need in the community. And finally, the Tennessee Sports Gambling Fund, $4.1 million. As you all know, that's already set up, and the interest and the dollars that come to us, we have to have a plan to fund that. So we're asking to be able to continue to offer those services with that money. In closing, we'd like to say we're grateful for your leadership, your stewardship of our state's resources, and your support for the people that we are blessed to serve. Taking it back to paraphrase Dickens, we are blessed to work each day to bring hope for those in despair and light for those in darkness. With that, we'll take any questions that you guys might have.
Thank you. Representative Martin, you're recognized.
Thank you, Chairman. I just wanted to briefly speak on the school-based liaison. That is a fantastic program. We're seeing it in West Tennessee, rural West Tennessee, the impact it's having. I'm a big fan of making sure we continue that, and getting one in every school would be a great start. But thank you for what you're doing, leading the way in that category. From rural health, it's making a big impact. And tying that into the telehealth aspect is key too, because we're short
Yes.
on providers, and having that resource available to them has been
Mhm.
excellent. So thank you for what y'all are doing on that half, and we
Mhm.
want to continue to reach out and help any way we can. So thank y'all.
Thank you. One of the West Tennessee providers is in the audience, CEO Jimmy Jackson. Do you want to stand up, Jimmy? There you are, sir. So glad he's here. He's hires some of these, and I know that Tamho's having their executive membership meeting, so I don't know if we've got any more providers, but since you said West Tennessee, I'd seen Jimmy, so thank you.
All right, thank you. Next on our list, Representative Hakeem.
Thank you, Mr. Chairman, and thank you all for the great work that you do. We very much, it impacts our state in a very positive way. I wanted to ask, do we have any idea to percentage of adults or young people that may not be receiving services who need it? Sometimes it's still looked at as a negative to own up to the fact that there are issues that need to be dealt with. And do we have any plan that would bring them into the light, so to speak? Needs can be met, so to speak.
Thank you for asking about that. One of the things that we often say is that our state's very fortunate that 95% of the kids are covered by some sort of insurance, right? So when you start there, whether it's private or TennCare, you got that access portal. And then, of course, for the other 5% that we talked about earlier, you guys have given us funding to serve those individuals through the behavioral health safety net. As it relates to the question about numbers, it's really hard for us as we only have one group that we look at, which is the uninsured. And so when you saw that gap that we have, it's right around 3,500 kids that are uninsured. But just because they're in the prevalence number doesn't mean that they've sought help. That's why we're so focused on the school-based behavioral health liaison program, because you all have set up a network that allows any kid to get services. So if we can find them, as you said, bring to light, and I know you're from Chattanooga, right?
Yes, ma'am.
Yeah. So you got great providers there. So if we can find those kids and identify them, we've got the money, and our providers have the money to serve them both through state funds and TennCare funds. But I can't give you a direct overall system just for the uninsured is what I can answer.
Thank you, Mr. Chairman, and thank you.
Thank you.
Thank you. Chairman Hicks, you're recognized.
Thank you, Mr. Chairman. Commissioner Williams, good to see you and
hey.
your team here. My question is kind of revolves around Vivitrol. This year, we reauthorized the balance of the $2 million that was appropriated for last fiscal year for Vivitrol that's in the jails, recovery courts, and really any other corrections-oriented opportunity. And of course, I think it goes without saying, we want to make sure that you have the funding needed to help people rehabilitate after they've gone through the detox process from opiates. So my question is, how is this process going? And, what else do we need to do differently this year with funding to make sure that that you can spend the money to help anyone in our state who is under the supervision of those judges, sheriffs, or Department of Corrections that are struggling with opioid usage?
Thanks so much for asking about that. Matt, who serves as deputy commissioner, has worked very closely with the Sheriff's Association to outreach to sheriffs across the state to say, hey, we've got these dollars, you guys have allocated them, and we could do Vivitrol with the jails. To date, we have not seen a real big uptick. We did another push, I believe, in December, sent out other letters saying, please let us know. We would love to fund you through these state dollars, but we're, as I said, not seeing a big uptick. Matt, anything you want to add to that?
Representative, I was actually meeting with our Assistant Commissioner over our Division of Substance Abuse Services earlier today because we're submitting a report to the legislature on this topic. I will say, related to Vivitrol in the recovery court setting, it is being utilized, which is great. But to the Commissioner's point, I think with the local jails, we're still seeing a slow uptick in local jails that want to partner with us and our providers to do it. But we got a great partnership with Sheriff Bledsoe, who runs the Tennessee Sheriff's Association. We've had ongoing discussions with him. We're going to be presenting, I think, to his sheriffs coming up in the summer about this opportunity. There's probably 3 or 4 jails that are currently partnering with us on the Vivitrol in the local jail project. We'd love to do more. So any advocacy that y'all could provide on that front, that would be helpful.
Yeah, you're recognized.
And changing gears just a little bit, talking about the K-12 Mental Health Trust Fund. So $250 million was originally put in there. So I guess my first question, I know 25 million was put into a reserve that can be, that's where, the money's spent out of. How much has been spent so far out of that mental health trust fund? I think per year, I think we've made about somewhere around $60 million a year, I think is what I've been told. There's going to be another transfer of about $75 million into that reserve. So I guess, and I'm sorry, I'm asking 15 questions in one sentence, but first of all, how much has been spent? That 75 million, what's the plans for that? And I know that has to go before the trustees and they have to approve that, but talk a little bit about even that process and what that's been like.
Well, we can spend the money when it's given to us, right? So the trustees approved $6 million in November. We were afforded that money, Jean, in December, January. And when we were going over the plans, $4 million is non-recurring. And we've issued grants for that funding to our provider community and schools in tandem for that. And then $2 million is recurring. And our goal is to actually fund more school-based behavioral health liaisons and apportion those based upon need and population. That should allow us to hire 87 more school-based liaisons. So to date, as of January, and we're in February, we were given $6 million. We have done the announcement of funding. So I will be able to report back better in next year than I can right now.
All right. Thank you, Commissioner. Thank you, Mr. Chairman.
Thank you. Chairman Hawk, you're recognized.
Thank you, Mr. Chair. Commissioner, thank you so much for being here and your team. We appreciate the work that you do as well as your friendship. So thank you very much. I hope this is an appropriate question for your department. It may be for Department of Health as well, but a few years back, we passed the Tennessee Together legislation that has, one of the efforts in that is to attempt to stop that initial addiction to opioids. And I'm wondering if there has been some way, and Dr. Terry passed some legislation last year, actually even given further powers to that. But I'm wondering if there's been a way to quantify how we're doing in stopping that initial addiction to opioids. Is there any way, or is that just a number that we've stopped something and we can't calculate that?
We are absolutely able to calculate, and it's both us and Department of Health who looks at the MME equivalents that are actually dispensed. They have gone down, no doubt about it. The outcomes that we had with TN Together, as well as Prescription for Success, have hit every goal. And if you want us to follow up and send you that, because we had goals and milestones that we had to meet, we'd be more than happy to do that. But as you're aware, what's happened is not so much anymore the pain pills that are prescribed. That's really gone down. What we're seeing are people buying pills off the street that are fentanyl laced. They're more deadly. And so when we look at overdose numbers, it looks like, wow, are we making a difference? Absolutely. But it's switched. The drug is switched. So in our work with TBI, we're doing all we can for those individuals to not take that first step and take a drug that's off the street.
Thank you. And that information would be of great value to
Okay.
us. And I know that Dr. Terry would be glad to, if you want to send it to his office, maybe he'll get it out to all of us, or just whatever the conduit is to
Great.
get it to the members of this committee. That would be some very valuable information. Thank you so much.
Great. Thank you.
Thank you. Chairman Clemens, you recognize.
Thank you, Mr. Chairman. With regards to the school-based behavioral health liaison expansion and the $6 million request, and you've requested 86 contracted liaisons, and you said the goal was to have one in every school.
Yes, sir.
How short are we currently of having one in every school?
Great question. There's about 1,800 schools across the state. These funds would get us up to around 400 to 450. I can't tell you for sure yet, because we've also got the money that we've put out in the recurring through the trust fund, but we're hoping it would get us to 400 to 450 schools.
You recognize.
So, thank you, Mr. Chairman. So how did you decide on 86?
We originally had asked for more than that, but this is what's in the budget. And then the second thing that's really important, because we're struggling with workforce development, we're wanting to phase this in. If we were to ask for 1,800 right now today, we really don't have the workforce to cover that. So it's sort of a phased in approach to be able to get that across our state and our schools.
You good?
Thank you, Mr. Chairman. And you touched on the 1,300 plus children who are served by the behavioral health safety net. Now, TennCare Kids provides behavioral health services.
Yes, sir.
And are these children not covered under TennCare and they're in the safety net?
Yes, sir. So what happens is these are kids that are uninsured. They're not covered by any insurance. And it makes it really easy for a superintendent or a principal to give that kid what they need, because our provider will say, we'll serve them. We've got the safety net. Some of these kids are able to transition, and we have the numbers related to those that transition after a first or second service to TennCare. But when they start with us, they're uninsured.
And so what's the cost associated with that safety net investment for 1,300 children? Because I don't understand why they're not being covered under the current TennCare Kids program and they're falling into the safety net.
Well, because they're not insured at the point of an issue that's arisen, right? So if you're a principal, a kid's acting out, you're in a rural community, and I've seen this in West Tennessee, they don't have any insurance. They're able to be seen by our provider, who does both uninsured services through the safety net and then TennCare services. When that kid gets that service, they're uninsured. So we provide it, we fund it. Then the provider attempts to get them on TennCare. So it pays for that first, second, third service, and then they go on TennCare. But at the point that they are being seen, they're uninsured.
Okay. All right. Thank you, Mr. Chairman.
Thank you.
Thank you. Chairman Carringer.
Thank you, Chairman, and thank you, Commissioner. And my colleague next to me asked one of my questions about how many did we have and how many would we like to have to be able to have one in all of our schools. And then I just wanted to say a thank you to Helen Ross McNabb, who's in my area and have been involved with them for many, many years from being there in Knoxville. And just to lighten a little bit of the mood, the Central High School that you all saw displayed up there is my alma mater.
Okay.
So I know all about that entire building up there. So I say go Bobcats.
Fantastic.
You recognize.
Yeah, and I must say my District 16 is where it sits.
Okay.
So thank you.
Thank you.
All right, Representative Bain, you recognize.
Thank you, Mr. Chairman. So I had a constituent email me who's a close friend whose husband is suffering from a gambling addiction. And I just had no understanding of the severity of the problem and how expansive it is across the state. So my question is about the gambling fund. So in August of 2023, sports betting handle rose to about 243 million, which was up from 13.6% from July of last year.
Right.
Revenue keeps increasing as sports betting keeps increasing. And my understanding is that's taxed at a 1.85 percentage rate, but that's not why we're here. But my question for you all, I was pleasantly, I really appreciate your office coming to me to discuss this program, and I think it might benefit all of the members here. If you could provide some information as to the trajectory of this fund as sports betting revenue increases and its utility in providing resources for gambling addiction in the state. Thank you.
Thank you so much for asking for that. And also, I'm really excited you're a licensed social worker. Many of us up here are LCSW, so excited for what you do. Matt is working very closely with that with Taryn and in the audience. Matt, do you want to respond to that?
Yes, ma'am. So we have a partnership with the University of Memphis. They have a gambling clinic that started, I believe, 20 years ago. And our partnership goes back almost that far when the lottery was created. But through this revenue from the sports gambling, we've been able to expand that partnership. There's a new website created called thegamblingclinic.com. That was something that these funds help support. It's provided an online portal for folks who are seeking gambling addiction treatment. They're also partnering for the first time with East Tennessee State University, recognizing that obviously they're in the western part of the state. We're trying to build resources for gambling addiction treatment statewide. So they, through these funds, partnered with ETSU, who also has created a gambling clinic there. And we're soon to announce a new Middle Tennessee partner. But to your point, Representative, I mean, we met with the executive director from the Sports Gambling Council a couple weeks ago, and it's our understanding revenue for that has almost outpaced the lottery, if not already has. And you know, gambling addiction often co-occurs with other substance use addiction, so these things go hand in hand. But really fortunate to have the partnership with the Gambling Clinic. But that website is really what I would promote, thegamblingclinic.com.
All right, thank you. All right, Representative Hicks, you're recognized.
Thank you, Mr. Chairman, and Commissioner Williams. Thank you so much for being here and your team, and thank you for what you do. When you first started, you told a story and talked about hitting rock bottom. Something I know a little something about. I've hit my life through addiction as I've hit rock bottom twice in my life, and I know a little something about it. Thank the Lord. The last one's been 21 and a half years ago. So that's a good thing.
That's awesome.
Lord's been good to me. But it takes a lot to work through recovery. And what I'm learning here is there's not really one silver bullet. It takes a team, and it takes all different kinds of aspects of recovery because we're all different. God made us that way. And I think it's important to know that. One thing that we have sort of worked on and been a partner with in Northeast Tennessee is the Northeast Tennessee Regional Recovery Center. Something that we've worked on. The partnerships in that has been mental health and substance abuse, been all the judges through the recovery courts. You know, that's getting people and meeting them right where they're at. I think it's extremely important place to meet people. We actually had 9 counties go together on this, and it's sort of ran by Families Free. And I was just curious if you had any kind of an update on what's going on there and how that program's going, and just your thoughts on that.
Well, thank you for asking about that. One of the things that we loved about this project was the fact that all these judges and counties and mayors and executives came together and said, hey, we care about this and we're going to pool our resources. We're going to very much focus on this population in Northeast Tennessee. I know you had a lot to do with that. So I can't thank you enough for that. They broke ground last month or 2 or 3 months ago. I think that they're slowly bringing in individuals into the residential piece, and we're very hopeful for great outcomes. Families Free does great work, as you know, in East Tennessee. Again, we'll have more to report as they've been open longer. Does that help for you?
Very much so.
Good.
Thank you. And
Thank
the
you.
legislature, you know, all the Northeast delegation really worked hard on that. So I just appreciate everything you do and look forward. I think currently they have around 12 to 15 men, and I think
Mhm.
7 women in the program.
Mhm.
So it'll change lives.
All
So
right.
thank
Our
you.
assistant commissioner just confirmed that.
Thank you. Thank you
Thank
so
you.
much
Thanks,
for what
Darren.
you do.
Absolutely. Thank you, sir. Thanks for your witness too.
Thank you. Representative Hemmer, you're recognized.
Thank you, Mr. Chairman. Thank you, Commissioner, and your team for your presentation today and the work you're doing in some really important space. Had some follow-up questions regarding the behavioral health liaisons. First of all, thank you and your team. The chairman and I had a lot of questions after special session about behavioral health liaisons and federal funding for that. Your team was pretty helpful in helping us sort through those and understanding so we could let our
Right.
local LEAs know that. So I wanted to give you and your team credit for your diligence in that. And then secondly, looking at the behavioral health liaisons that you've added to the budget, and thank you for your continued advocacy for that. About 114 were listed, but wondering how do you all decide, or what's the program operations on where these health liaisons get assigned essentially?
Yeah, we look at the data related to number of students, right? And then number of resources within that school and that region. Once we determine that based on the dollars we get, so for example, let's say $6 million is what we're asking for. Our team looks right now at where we funded liaisons, where they're geo-located, and then we look at number of kids so that we're trying to get proportioned across the state, the same number of liaisons to number of kids. So for example, Davidson County, Shelby County, Knox County, higher population than what you might have in Crockett County, where I'm from. So that's how we're doing it, to proportion it based on need and population of kids.
And what is on average, or maybe on average today, or what is on average after this new formula, what an average caseload or workload for these behavioral health liaisons are?
That's a great question. I'll ask Deputy Commissioner Yancey if he wants to speak to that.
Yes, ma'am. I think, Representative, ideally, we would have one liaison per school. And when you look at recommended ratios for student support professionals per student, it's usually one professional per 250 students or 500 students. So that's the goal. As far as a caseload, it really depends on how they are operating within their assigned school. So certain schools are using these positions to do more what we call tier 1 services. So they're working across the school, providing school-wide intervention, trainings, campaigns, programming, all the way up to what we call tier 3, where they're doing more individualized counseling with kids. And for those services, you would imagine that a school-based liaison would probably have no more than 20 students that they're working with at one time for those students who need intensive ongoing services. The other thing that I think is important about the liaisons is they serve as a referral source for those students who may need more intensive services. So for kids that need, medication management, case management, the list goes on and on. The unique thing about these positions is that they're employed by community mental health centers, so they're able to expedite referrals back to their employer if the parent consents. So, but it's hard to really say what the average caseload is because their jobs look a little different per the school they're in.
Thank you.
Thank you. Thank you, Mr. Chairman. And you mentioned earlier, Commissioner, that in your budget request, you asked for more, but I pulled up your budget request and it actually shows only 114 positions were asked for. So is there somewhere else that you're asking for more behavioral health liaisons?
When I was speaking to that, I was talking about our original budget request, and this is what the governor included in his budget.
Okay. Yeah, and I was actually referencing the governor's budget request that
Right.
you did previously when you presented to him in the budget hearings. So my back of the napkin math shows we're missing about 1,028 behavioral health liaisons, which would be about $72 million. So how do we close that gap to get that goal of every school gets a behavioral health liaison?
Right. So as we discussed, we're wanting to phase this in because we don't have enough staff across the state right now. If we were to say we're going to hire 1,800 today, we need more people in this state to get into this field to hire them for it. But our goal is to continue to phase in and come back each year and ask for more liaisons to be able to meet that goal.
And to that point, thank you for that clarification. How are you recruiting and training
Yeah.
the workforce to meet that need.
Thanks so much. Y'all gave us a lot of money during the special session, and it allowed us to do multiple things that are impacting the system as we sit today. One thing is tuition stipends that are being overseen right now by TAMHO and TADIS to be able to get people in the field, the social sciences, social services field. The second thing that you've done is to give funding to be able to do bonuses as well as give increases in salary. And that's also impacting to get people in and saying, hey, I want to do this work, right? So those are a few things that you guys have funded to help us with this situation. Thank you for asking.
Chairman Kumar.
Thank you. Thank you, Mr. Chairman. Thank you, Madam Chair. There are a lot, we really admire your work and your team. You work against tough odds, dealing with substance abuse. I just in follow-up of the discussion about Tennessee Together and subsequent legislation, I wanted to say that the medical profession has done very well. The amount of prescriptions on opioids written is down by 50% or so, so that all the extra stuff does not fall into the wrong hands. However, the sobering fact, this is my memory, kindly correct me, is that whereas the medical profession cut the prescriptions down, legal prescriptions are down, amount of opioids prescribed are down, however, the cartels have stepped in. That's not your problem. That's a law enforcement problem and problem from our southern border. But the cartels have stepped in so that overall consumption is up. The number of overdoses and deaths are up. I believe Tennessee, didn't we have the highest ever number of opioid or fentanyl-related overdoses last year? And Davidson County is number 2 in the nation behind Baltimore in fentanyl use or abuse. So these are sobering realities. We can pat ourselves on the back for having done what we did to cut down legal opioids. But then again, a law enforcement problem or the southern border problem, as well as the cartel stepping in, we are losing that battle. Am I making the correct statement?
I appreciate you bringing that up. As I said earlier, we have a very strong partnership with TBI because, as you said, this is not a one size fits all response because it has changed. How people are taking drugs and what they're dying of has absolutely changed from 10 years ago. What I can tell you is my friend at TBI, Director Roush, has asked for more agents so that he can respond to this issue. He needs staff just like we need people in the field to help individuals recover and want to recover that are struggling with addiction. Because as you know, if someone has an addiction issue, they're looking for that substance. If we can get to them, we can also help with them wanting to continue on a substance. So I can say that we're grateful for our partnership with TBI and the help that they do related to the legal ramifications of the overdose and what's happening with that.
Well, thank you. The concern is that I feel guilty that this is happening on our watch, and you do too. You do too. Our hearts are in the right place, but these are forces beyond our borders, beyond Tennessee borders, that we cannot control. And as a result, the end result is that we are losing the battle. Yeah. Thank you, Mr. Chair.
All right, thank you. We have one. Oh, Mitchell. All right.
Yeah, Mr. Chairman. Yeah, I just wanted to let the committee know I do have a bill to fund all those school counselors. If you want to take a look at it, it's HB 2193. It'll be easy to fund all those counselors with that bill. We'll have the revenue to do it. Thanks.
All right, thank you. So there's one last person on our list, and that's me.
Yes,
Thank you for coming. I appreciate the presentation and all the information that you give and all the great work that you do. And obviously, you know, with the behavioral health liaisons in the schools and dealing with that, we're looking at, the diagnosis and getting treatment for that. But obviously, it begins with prevention.
Right.
And so there's a lot of correlation coming out. I think social psychologist Jonathan Haidt had presented some information. He's got some more information coming out about this with moving away from a play-based childhood, and now they're phone-based childhood, particularly with social media out there. Can you talk a little bit about that and how that is impacting our youth, particularly when you go into, particularly as you get to adults and you have different types of personality disorders, whether it's, you see on social media, the histrionic,
Right.
the
Right.
antisocial, and that. Can you talk about that, please?
Yes, sir. It's obvious, if you just watch people that you love, family, friends, how social media has impacted kids. They can't get away from being bullied. If they are the target of being bullied, they can't get away from being made fun of. If they're that target, it's 24/7. If any of us, whether we were a kid or an adult, had to endure that day in and day out, it absolutely is going to make an impact on you. Both an increased anxiety and increased depression. We went over that a little bit, Chairman, earlier in the presentation. So we absolutely agree and know that that impacts our youth, and that everything we can do related to that is going to be extremely helpful to our youth.
And thank you. And to one of your slides about the youth suicide, it's impacting young women greater than men. And so I just wanted to make that point of, that's something, if we can get that on the front end and whatever we can do to address that, obviously that helps us on the back end. Being ranked number one is great, but if we could be ranked number one on
Yeah.
prevention on the front end, that'd be great too. So,
Yes, sir.
all
Yes,
right.
sir. Would
Well,
agree with that.
all right, thank you. So, no further questions. Again, thank
Thank
you
you.
guys for coming here. And
Absolutely.
so we will go back into session. Any further comments from the committee? Okay, seeing none, we are adjourned. Thank you.